Millions of people wake up every morning already exhausted. They battle severe migraines, facial pressure, random nosebleeds, and the lingering fatigue of sleep apnea. The standard response is to treat these as separate, systemic problems. You might cycle through different painkillers, run humidifiers at night, or stack specialty pillows, only to wake up with the exact same symptoms the next day. But what if the root cause of this relentless cycle is actually a hidden physical defect inside your own airway? This diagram shows the nasal septum, the central dividing wall of your airway. Normally straight, it allows smooth, unobstructed airflow. But when this delicate wall warps or fractures, the airway narrows, forcing air into a chaotic, compressed bottleneck. A shift of just a few millimeters sets off a mechanical domino effect that degrades your breathing, your sleep, and your overall health. This deviation takes several distinct forms. The septum can bow into a C shape, twist into an S shape, thicken with scar tissue, or dislocate entirely. One aggressive variation is a septal spur, sharp cartilage jutting out, physically pressing into the sensitive lateral wall of the nose. This constant mechanical crushing against sensory nerves triggers the continuous release of pain neurotransmitters. The clinical result is a rhinogenic contact point headache. The irritation radiates outward, causing intense pressure across the face, severe migraines behind the eye, and pain echoing inside the ear. People often spend years seeking treatment for neurological migraines, unaware that the pain is the direct mechanical result of cartilage grinding against a sensory nerve. Beyond bone and nerve compression, a deviated septum also radically alters the physics of your breathing. When inhaling, air squeezes past the structural bottleneck. Instead of gliding smoothly, it accelerates, ripping through the gap to form a high-velocity, turbulent vortex. This fast-moving air acts like a harsh wind tunnel. It rapidly dries out and cracks the thin mucosal skin covering the contact points, serving as the physical trigger for chronic, recurrent nosebleeds. At the same time, friction between these narrowed tissue surfaces traps mucus. This prevents normal drainage, leading to localized fluid buildup, cellular damage, and persistent sinus infections. And when you lie down to sleep, this localized blockage becomes a systemic liability. A restricted airway physically limits the volume of oxygen reaching your lungs. This diagram shows how the restriction is frequently compounded by a concha bullosa, an air-filled pocket within the middle turbinate. It sits directly next to the deviated septum, bulging outward to claim whatever tiny fraction of breathing space remains. Your body reacts to this oxygen starvation by forcefully pulling for air, vibrating the throat tissues into severe snoring and triggering obstructive sleep apnea. Night after night, this poor sleep quality drives up blood pressure. The nose ceases to function as a vital delivery system for oxygen. Instead, it acts as a systemic choke point, compromising cardiovascular health and blocking the body's ability to recover. Because this is a physical obstruction made of bone and cartilage, pills and nasal sprays offer zero permanent relief. It requires precise mechanical correction, which starts with rigorous diagnostic mapping. The investigation begins with a nasal endoscopy. This allows a doctor to visually navigate the interior of the airway, pinpointing exact mucosal contact points and checking for the presence of nasal polyps. Next, a CT scan provides a complete topographical map. This scan measures the exact angle of septal deviation, locates any hidden concha bullosa, and rules out underlying pathologies like bone erosions or teeth infections. To measure the daily impact of the blockage, doctors use the NOSE questionnaire, a 5-point evaluation scale that quantifies exactly how severely the obstruction degrades the patient's quality of life. Once the obstruction is mapped, the definitive solution is a septoplasty. This is a targeted surgical procedure designed to structurally rebuild the wall, treat the turbinates, and permanently open the airway. If you are experiencing breathing issues, intense headaches, and poor sleep quality, consult Dr. Kevin So. He has 30 years of specialized clinical experience in investigating, diagnosing, and surgically correcting these exact structural bottlenecks. By identifying and physically repairing the root cause, you don't have to tolerate a compromised airway. You can finally breathe clearly, sleep deeply, and restore your optimal health.